Hey everyone, welcome to part 2 of axial muscles. Now we're going to cover anterior axial muscles. All right, so just remember we're moving from that superior end, right, the head and neck muscles. We're working our way down, more inferior. We're going to cover thoracic and abdominal muscles now. All right, sweet. So the first one is the external intercostals. Remember, note that asterisk there, meaning that your TA is probably going to point this out to you on the body donor. And we see one action here. I'm going to skip the whole spiel. But the real important kind of piece of this puzzle is expanding the thoracic cavity, specifically for inspiration. Now, I know inspiration, just from what we know usually means like, oh, someone has like motivated you to be a better person or whatever. But in this case, inspiration means breathing. And so here, the especially for the ribs and expanding the thorax, these need to move in order for your lungs to accommodate more air. And so the external intercostals are going to play a huge role in making sure that you can breathe. Now, the internal intercostals, oh, let me exit drawing. All right, are going to be doing kind of the opposite effect, right? These are more prevalent in forced expiration. And so once again, expiration in this case does not mean like something is out of date, right? This means that any sort of breathing out. So internal intercostals are super important with helping to compress your thorax. Oh my gosh, and expel air. Oh, please. Hold on, please. Okay, there we go. Sorry. All right, sweet. Okay, let me get rid of this. All right, next up we have the diaphragm. And so remember that one, the diaphragm is the prime mover or agonist of breathing. And so this one here is going to, the diaphragm in its usual shape. Let me make a note. So this is a relaxed diaphragm. So you see that kind of a rounded shape, relaxed. So a relaxed, rounded diaphragm. And then when it contracts, whether it's through like voluntary movement, because the diaphragm is a voluntary muscle, or through, interaction with the medulla oblongata, it's going to flatten out when it contracts. So this is it contracted. And so what that allows you to do is if your lungs are here, oh my gosh, I'm so sorry for my bad picture, right? If your lungs are here, right, they're kind of squished by the diaphragm here. Whereas when the diaphragm contracts, now your lungs have a lot more space to actually fill in with air and get all of the wonderful oxygen into the lungs. So here we see relaxed diaphragm is that dome shape, right? It's going to push against the lungs and prevent oxygen from entering, versus contracted is going to allow for expanded lungs and all that really cool stuff. So that's why it's the prime mover of inspiration. And so here we see what contraction does to the rest of the body, right? It's going to help with compressing the abdominal viscera. And viscera just means organs, right? As well as with childbirth and with expulsion of urine and feces. Just so fun. What a multi-purpose full muscle there. All right, let's keep moving. All right, next up we have the rectus abdominis. We've seen this one before. Now this one is another combo slide, right? So we'll see this on the body donor, as well as needing to know the origin and insertion. And so just to note, right, like last time, just going quickly over origin and insertion. Origin, that's probably the place in, so muscles have usually two places where they're attaching to the body. The first place is usually more proximal. This is the place where the muscle isn't moving as much, right? Versus the insertion, that's a place where a lot of that dynamic action is happening. It's usually more distal, and a combination of these factors help in the muscle contracting will always pull from the insertion, or that kind of point of a lot of movement, towards the origin. And so here in the rectus abdominis, or our ab muscles, we see that the origin is the pubic symphysis, right? That kind of band of fibrocartilage down. Let me change the color so we can see. That band of fibrocartilage down here in between your os coxae, as well as the superior margin of the pubis, right? So pubis, if this is your, oh my gosh, am I going to draw this? Yeah, os coxae. Oh my goodness, look at that. Okay, so os coxae. There we go. So the kind of superior portion of the pubis and the fibrocartilage pubic symphysis, and the insertion is going to be the xiphoid process. And so now take a moment. Where is the xiphoid process? What is that? You got it. Yep. So sternum is up here, and so we have the manubrium somewhere here. We have the body, and then at the very end, oh my gosh, I don't know if the, okay. Yeah, so that's the xiphoid process. Let me get out of the drawing now because it's looking a little crazy. All right, sweet. And so now you might be thinking, okay, so going back, right? Origin, the point that moves less. And that logically makes sense, right? Because pubic symphysis, that kind of band of cartilage in between your hip bones, do you want that to move? Right, like when you're walking around, do you want your hip bones to shift? No, right? Because you're gonna fall and it's gonna really hurt. And so, but here we see and so that makes sense that that's the origin. But then the insertion, remember, last time we talked about, would we want our sternum to move? And that's a no as well. But when we think of this, the best way I could think about it is like doing crunches, right? Where if you're pulling this part of your body up towards your legs, right? Your xiphoid process in your sternum is moving through that action, and the pubic symphysis is staying still. And so that's how the rectus abdominis is working. We're pulling that insertion point, kind of the xiphoid process, that that part of your body closer to that pubic symphysis through that action. And so here we see that flexion of the trunk, right? So this is like your crunches, right? Crunch. Gosh, okay, I'm done. I'm not gonna draw again. And then we see, right, stabilizing the pelvic region, as well as compressing abdominal viscera. And so, like I said before, and I'm sorry I didn't note it sooner, if you have a list of like 3 or more actions, I would prioritize 2 to memorize, and then you can come back later on to like make sure that you know all of them. But at least for, just to help with being overwhelmed, like find the 2 that speak to you the most and memorize those. All right, next up, we have the external abdominal oblique. Now this one here, this has a lot of actions as well. And so we see it playing a role, same as the rectus abdominis, to help support your organs. It's going to help stabilize the vertebral column. It's also going to help with contralateral rotation of the waist as well. And so you can pick like the 2 that you fancy the most. Oh, that's cool. All right, sweet. Next up, we have the internal abdominal oblique. And just a reminder that the internal abdominal oblique sits underneath, or it's deep to the external abdominal oblique. So keep that in mind. And so it's also going to be doing a lot of very similar functions, right? So we're supporting the organs, the vertebral column, we're helping with posture, and then we see this ipsilateral rotation as well. So ipsi, right, this kind of root here, or this prefix here, just means same. So any kind of rotation on the same side is going to be aided by this internal abdominal oblique muscle. All right, now lastly, we have the deepest of the abdominal obliques group. This is the transverse abdominis. And so this one is also going to be doing basically like the same functions, where it's compressing the viscera, right? It's helping to compress organs essentially, but it does not have any contralateral or ipsilateral rotation functions. It's just compressing the viscera. And so just note that for transverse abdominis, it's just compressing viscera. All right, perfect. Next up, we have the linea alba. And so remember this one, it's not a muscle. It's just a landmark that's helpful and fun to say, right? Linea, and I think it's Latin, it means line. And alba, I think means like, what is it like? I don't remember. Don't quote me. But this is just a fibrous structure running from the xiphoid process all the way down to the pubic symphysis. So very, very cool. Linea alba. I like it. This is like my muscle or my landmark that is like a break. It always makes me happy. All right, next up we have serratus anterior. Now this one here, once again, we have to know origin and insertion. And so the origin is really nice. As you can see, it's basically all the ribs. So very good. Just write all ribs on your practical. And the insertion is going to be the medial border of the scapula. And so let me draw a picture. Like, let's pretend we have like an X-ray image of the body. And we see the scapula here. Let me draw on that lateral border. And then we have like yeah, perf. Okay, so scapula, kind of the general. Oh my gosh, I messed up. I messed up on this side. Don't look at that side. But here, right, this muscle, the serratus anterior, what it does is it wraps around. It's going to connect at right here, this medial border of the scapula, which is right along the spine. And then it'll come in, wrap all the way around through the back to sit on the ribs. So it's a super huge muscle. And so some of the actions here is it's going to work with the pectoralis minor to protract the scapula, right? So it's a synergist in scapular protraction, right? It's helping another muscle in protracting the scapula. And it's the prime mover in anything where you're like pushing forward or trying to pick up something in front of you, kind of like that reaching towards something is the serratus anterior. And it's also going to fix the scapula or keep the scapula in place during abduction of the arm. And so remind me again, what is abduction of the arm? Right, think of like abduct, right? So we're taking our arm away, like, right, like, oh, they're taking my, dog or something. They're abducting my dog. They're taking my dog away. Abduction is taking away. So we're taking away from that midline. And so some people know it as the boxer's muscle. Just, it's serratus anterior. Don't put boxer's muscle on your practical. Alrighty. Sweet, let me exit drawing. Okay, sweet. Next up, we have pectoralis major. Now this one too, another major one. Look at all of the origin points for this muscle. Like I said before, usually it's about, one origin and one insertion per muscle, like 2 points of connection. But for some, there are quite a few origins. Now, I personally, my rule of 2, that would still apply, at least for me. But, make sure that you, at least, like, by the time you get to the practical, you're knowing every single origin point on here. Yeah, all the origin points. So we have the medial half of the clavicle, right? Let's see if I can draw this, right? So medial half of the clavicle. Oh, that's in purple. That's not going to be helpful. Yeah, here. Then we have the lateral margin of the sternum, right? So kind of like this along the body, kind of that lateral point leading towards the costal cartilages, as well as all the costal cartilages going down, 1 through 7. And then the aponeurosis of the external oblique. All that means, aponeurosis just means this is a type of tendon. It's like a flat tendon. And so kind of that tissue that's helping keep the external oblique in place is also helping connect the pectoralis major. But the nice part, and I said this before in the previous video, lots of origins, usually one insertion, which is really nice. And the pectoralis major, is going to insert on the intertubercular sulcus of the humerus. Now remember, we have the head of the humerus, on one side, and then on the other side we have the greater and lesser tubercles. That kind of groove in between the greater and lesser tubercles is the intertubercular sulcus. So just keep that in mind. And so now, right, we have this list of actions. It's going to help with flexion of the shoulder. And so remember, in anatomical position, we're starting at extension. So anything kind of raising the shoulders, you know, closing that distance of the shoulders is flexion. And then we have adduction of the shoulder, right? So adding back to midline, ADD for add. That's happening as well. And medial rotation, right? So anything moving towards that midline. Why is my face going away? Anything moving towards that midline is what the pectoralis major is doing. So pick your flavor. You get two. You can pick two from this list, and then come back and review the rest. All right, perfect. Now, pectoralis minor, remember this muscle is deep to pectoralis major, so we have to pull this off in order to see the pectoralis minor. This one is also pretty chill, origin-wise, right? It's ribs 3 through 5, as well as the overlying fascia, but really it's just ribs 3 through 5. And then the insertion is going to be the coracoid process of the scapula. Now remember, pectoralis major is inserting on the humerus, right? Whereas pectoralis minor is going to be inserting on the scapula. So two separate bones. Remember, the coracoid process is that kind of crow-shaped extension near the acromion of the scapula, right? So that right there, that that coracoid process of the scapula. Now this one here, it's another synergist because it's working with the serratus anterior, as we saw on the serratus anterior slide, in protracting the scapula or moving your shoulders kind of forward. Oh, and you know what? That's a good time to stop. So I'll see you in the next video.